happy to have you on board. I would like to take this opportunity to welcome Professor Samuel so that he could share his presentation or remarks. Welcome, Doctor.
Thank you very much. I would like to thank you for inviting me and to join you in this conference. Talk a little bit about the International League Against Epilepsy and also about international policies and what the International League is doing in that regard. So I have no disclosures of importance for this, and this is the outline of what I would like to touch on in the next few minutes. And so the International League is an organization whose members currently are chapters in each country. We have 123 chapters representing 163 countries around the world, with 6 regional boards that are depicted here. As you can see, in Africa, our current chair of ILAE Africa is Dr. Angelina Kakoza from Uganda. And this is really what the ILAE is. It represents about 17,000 people. It's a global community. These are people in each country. It has over 40 working groups with about 700 to 800 epilepsy professionals. And this is the important thing. ILAE is an organization of epilepsy professionals. Any profession, people that are working on an epilepsy can be affiliated. And it's an organization of global partnerships. We work with our sister organization, the IBE, from very, very long standing. The ILAE is about 111 years old now, and it's been associated with the IBE from time immemorial, really. And we also work very closely with the WHO, but as you can see, we work with a number of organizations, especially global organizations in neurological disorders or in epilepsy related areas, and some of them are depicted here, not all of them, of course. Now, this is ILAE Africa. As you can see here, there are currently 17 chapters represented, and 3 are going to be provisionally accepted in the next General Assembly. And the current chapters are highlighted here in yellow in Africa. And Africa is a crucially important part of the world for the ILAE, representing 1.3 billion people. And there are several reasons why this is important. I'll highlight that in a moment. This is the ILAE Africa current board. As you can see, Dr. Kakoza, the chair, and then the previous chair, Dr. Gallo Diop. Our liaison is Dr. Helen Cross, as you can see here, and you can see other members represented here. And we have just elected a new, well, not we, but the community has elected a new board. And our new president or chair of the Africa board is Dr. Joe Wilmshurst. And 4 other people have been elected, as you can see here, and 2 more will be appointed. So why is Africa crucial? Well, you can go to our website and you can look at these figures, right? I mean, there are tremendous challenges in epilepsy care, and many of them really are related to urgent public health needs. And these reflect the fact that Africa has the highest incidence and prevalence of epilepsy, high stigma, highest treatment gap up to 80%, limited education and skilled personnel, and then limited interaction between organizations, government bodies, etc. So what does the ILAE do? Well, the ILAE does a number of things, including education. Dr. Helen Cross probably highlighted some of these aspects: education, advocacy, guideline production, etc. But I will focus right now on the aspect of epilepsy. So how do we advocate? Well, we try to focus on advocating in international regional agencies and governments, funding bodies, and emergency response organizations. We try to do that in the appropriate time or in a timely manner, opportunistically, responsively, and being very, very rapid to react to need. And then finally, in the way it matters, with the right message, the right audience, collaboratively, relevantly, and so forth. And this is a timeline, a brief timeline of some of the advocacy and policy aspects that the ILAE has supported over time. I've highlighted here in red some that are very salient. And so we started working with the WHO back in 1997 with the Global Campaign Against Epilepsy, and Out of the Shadows campaign was launched. And then if you go to 2005, this is the WHO Atlas on Epilepsy Care around the world, which highlighted the fact that there's enormous treatment gaps, in many countries. And then importantly, in 2008, the WHO mental health gap, which included epilepsy, and has been a tremendously useful vehicle for us to support epilepsy around the world. In 2011, various action plans and declarations on epilepsy, including Pan-American Health Organization, European Declaration, and others. And then go to 2015, and this was a remarkable year because first there was a resolution in the World Health Assembly to recognize the global burden of epilepsy. The first International Epilepsy Day by the IBE, our partner organization, was launched. And very importantly, the UN launched its Sustainable Development Goals, which is very, very important and guides to a large degree what the UN and WHO do with regards to epilepsy. And then finally, several declarations on epilepsy, as you can see here. And this will bring us to our more recent activities, which is most recently the first ever global report from the WHO on epilepsy, which is the WHO titled Epilepsy, a Public Health Imperative. This was launched in June in 2019. And this is the summary of these of this global report. It contains aspects of epidemiology, burden, current care, social aspects, research, et cetera, but it's a call to action. And this is a picture of when the report was launched in Bangkok during the International Epilepsy Congress, June 2019. So in September of 2020, the ILAE was invited by the United Nations General Assembly to present on a review they were doing of their sustainable global sustainable goals, the developmental goals. And you can see the goals are here. There's 17 of them. And the question was, do the UN Sustainable Development Goals address the global burden of disease? And what we did is they invited us to present epilepsy as a case study to demonstrate how a specific disease could be addressed as a global priority and use it as an exemplar for how other neurological disorders could be addressed in a broader framework of action. And we focused on number 3, which is good health and well-being, and number 17, which is partnerships for the goals. And this takes us to the last element here, which is the historic approval on November 9th of 2019 by the 73rd World Health Assembly of a global, the decision to create a global action on epilepsy and other neurological disorders interactive plan. So this is a 10-year global action plan, which will address multiple gaps, inclusion needs for research, and establish ambitious and achievable goals. And we are currently in the process, working with the WHO and other organizations, of creating that intersectoral global action plan that will be very likely approved in the beginning of 2022. I recommend that if you look at this paper, it delineates the road towards achieving this remarkable milestone in epilepsy for people around the world, which is the action plan on epilepsy and other neurological disorders. Why is this important? Well, I will use as an example the Global Action Plan for the Prevention of Non-Communicable Disorders. And this is a midterm evaluation of its impact. And you can see that the impact here, higher is better, of course. The percentage of countries that achieved disease management indicators after the action plan has increased in lower income, upper income, and high income countries. Similarly, the number of countries with established units for non-communicable disorders has increased substantially since the implementation of the plan. And very importantly, there is a reduction in mortality that is directly related to the country's commitment to adhere to the plan of action. So what does it mean for Africa? Well, I think that this global action plan is an unprecedented opportunity to ensure that epilepsy is placed high on local governments' agendas, to optimize the synergies in service and care with other neurological comorbidities, and to use epilepsy as an entry point to improve health systems across neurological disorders, and also an opportunity to reach out to other sectors to decrease stigma and exclusion, and to improve legislation to decrease discrimination. And with that, I would like to thank you.
Thank you so much for such a comprehensive presentation. What I've gathered from it is what ILAE is doing, challenges of epilepsy care, public health needs, advocacy policy initiatives that have been put in place to address public health in epilepsy, also what you've done on action plans, and the European Declaration, the 2015 resolution on World Health Global Burden of Epilepsy, which is so wonderful. I've seen how you've worked with the UN on the issue of development of sustainable development goals, and the various declarations that have been put in place, and the most recent, the global report from WHO on epilepsy, and the time to act is now. That's really, really wonderful. And also what you've shared in 2020 about the ILAE initiated to the UN General Assembly to review the goals, and the question was putting epilepsy as a case study. That I can say is really good work, and we really appreciate as IAA for how there is a lot of support from ILAE, especially through this presentation, of which we get to learn, and we also get to know how we can also put Africa up there. I'm happy to learn that through all these initiatives, there has been a great reduction on mortality rates from any non-communicable diseases, of which epilepsy is part and parcel. Thank you so much. So back to the members. If you have any questions to Professor Samuel, kindly, this is your time. Welcome.
Okay, I do have a question. My name is Anat, Dr. Wiebe. Just want to ask about the involvement of ILAE in categorizing epilepsy under mental health, MHGAP. Because I work in Ethiopia, and the problem we're facing, I mean, a huge challenges, because epilepsy is categorized under MHGAP. It's psychologists and the psychiatrists who are barely running the program, barely a program that is not there. So it is very difficult to engage neurologists or anybody else, because they're very protective of, oh, this is mental health issue. So we have meetings where people from the Ministry of Health telling us this is actually a psychiatric issue. So it really, I just don't understand what the logic was to categorize epilepsy under mental health.
Yes, thank you for that question. It's a very important question. For a very long time, we struggled with this issue because there's two things. One is the service aspect that you've highlighted, and the second one is the fact that in many societies and countries, epilepsy is considered a mental health disorder, or they think that people, if I may use the word, are crazy. For example, the word for epilepsy in Korean was crazy goat, right? And so you can imagine the stigma that carried for epilepsy. We struggled with this for a long time. The WHO decided to include epilepsy in mental health for the following reason, and I think that it worked well in some areas. The mental health, the MHGAP, contained a number of activities and supports from countries that could be used to help epilepsy. So in some countries, it was beneficial. Whereas in other countries, I can see the example that you gave very clearly in Ethiopia. This was problematic. The good news about all of this is that this is being solved with the recently approved Global Action Plan on Epilepsy and Other Neurological Disorders. So epilepsy will now move clearly to the neurological disorders arena platform, and this will be an international action plan, and this was happening in the beginning, probably February of 2022, will be approved by all member states of the World Health Assembly.
Oh, thank you. You really made my day, because it's just, that is brilliant. Absolutely brilliant. Thank you so much.
Thank you.
Thank you for that question, and thank you for the great response from Dr. Samuel. Our request, we reserve the other questions. You could reach out to Dr. Samuel directly. I believe he'll be willing to share his email address because of time. I would like to go to our next presenter, Dr. Daniel Gam Masi from Cameroon.